So the next question can be, any pregnant woman can ask, okay, now I know the importance of saving my cord blood. It can save life, it can treat 80 blood diseases, then it is important I save it and I don't throw it. The next question comes, which company should I choose when it comes to saving this very important treasure, which is cord blood and cord tissue? How can I make the selection of the company? There are so many different companies around me. Which one should I choose? So my piece of advice is always choose a company which is following an international standard when it comes to collection, cryopreservation, and isolation. Therefore, it's very important that I choose a company that follows the international standard. For example, some questions that a pregnant woman should ask the company. How you are collecting my umbilical cord? Are these nurses and doctors trained on the collection? Are you coming to train them on how to collect these cord blood and cord tissue? For example, that can be the first question. Second question, once you collect this cord blood and cord tissue, how you are transporting it to the lab? Are you keeping it under a specific environment? Are you making sure this environment that you are keeping the cord are monitored under a specific data loggers to make sure that the temperature stays safe from the hospital to the lab? This can be a very important question to make sure that the cells, they don't die. Third question can be, once it is received in the lab, what are the quality control steps you are doing? How you are isolating these cells? Are you isolating it with the method that is international approved? Are you doing any quality control to check how cells are viable? Are there cells, are you doing any viability testing? Are you checking the purity of these cells? Because we know that the cord blood contains many cells. How can I make sure it is only hematopoietic stem cells? How can I make sure it's only mesenchymal stem cells? Then are you doing quality tests to check the purity of these stem cells? Then the next thing, once you are isolating it, are you using manual techniques or automated techniques? Because we know that manual techniques is not as advisable as automated technique because it is closed system and less contamination. Are you doing sterility tests to make sure that before you save these cord blood into the tanks, are they free from contamination? They are free from viral infection, they are free from any bacterial infection. Are you checking this before you cryopreserving it for me? And the most important ones is that you ask, once I need it one day, how can I make sure there are cells alive? Are you doing any stability testing to guarantee for me after I need it in 10 years or 20 years or 30 years, cells are alive? So this is all the questions that you as a mother or as a father is very important that you raise it up to the company who you are saving your cord blood and cord tissue with. For example, we know that this cord blood and cord tissue are kept in the liquid nitrogen tanks to save it for 30 years. Do you have a maintenance contract for these tanks? Are you maintaining these tanks? So these important things, because it's your unit is kept inside, so you should be aware about that. You should make sure that all these tanks, the liquid nitrogen tanks, which is your unit in it, has a maintenance contract to make sure that it stays for long and is in a good stability and good environment until you need it in the future.